So I think it's very important to approach the physician-patient interaction from a team perspective and really take into account what the patient values and have a discussion with the patient about what they want from treatment outcomes, because in the disease that I focus on, which is sarcoidosis, the treatment can often be worse than the disease itself. And so really knowing what the patient wants and what they value is important in deciding what the best treatment options are for the patient. So I'm a pulmonary and critical care physician by training, but I focus on a disease called sarcoidosis, which is an inflammatory disease that primarily involves the lungs. However, it can involve any organ in the body. The primary cause and outcomes really aren't clear, which can make evaluation and treatment of patients very difficult. And so in evaluating patients, it's very important to talk with the patients about their symptoms and what they want their treatment options and outcomes to be. I think MUSC is more than just an academic medical center. It's really a community of physicians and practitioners and nurses who really are invested in the outcomes of the patients and being sure that patients have good quality outcomes and good experiences while they're here. So it's more than just coming to a place to look for answers. It's coming to a place to really get the whole picture and have someone who clearly cares about you and cares about how you feel and how the treatment affects you. So I really feel like within the disease of sarcoidosis, there is enormous room for improvement. There's very little known in terms of treatment, diagnosis, and the ability to contribute to the field to make patient outcomes better, to make patient evaluations and experiences better is all possible. And MUSC is really unique in that there's a lot of support for advancing understanding of disease and improving treatment outcomes. And I really feel like that's a huge area of opportunity here. I'm a native of South Carolina. I'm from Greenwood, South Carolina in the upstate. I went to Vanderbilt for college, then came down to MUSC for medical school, and then did my residency training and fellowship at the Medical College of Virginia in Richmond, Virginia. And then was excited to have the opportunity to return to my alma mater at MUSC and practice sarcoidosis.